Hey, my name is Dr. Sean Price, Clinical Coordinator here at ChiroSpa in Fort Walton. We're going through a series and we're talking about how our Rewired program works here in our office and what we can do to actually help rewire your metabolism and rewire your neurological function so that you can actually start restoring health and recovering normal function in the body. We talked about the metabolic aspect of care, and we talked about the neurological aspect of care and how we utilize glucose, oxygen, and metabolic pathways to provide proper fuel for the brain so the brain can start to heal. Today I want to talk about the activation aspect of it. Again, remember, brain therapy comes in the form of fuel and activation. So I want to talk about the activation aspect. What will happen is the reason we use oxygen with the breathing techniques and the techniques that we use in the office is because as we age, our ability to perfuse oxygen and absorb oxygen tends to decrease. When we become oxygen deficient, we lose the ability and the healing power of the body for one thing, but we also lose the ability of the brain to function at 100% or at optimal levels. So we provide these techniques to increase the oxygen content of the blood while you're in the office. And then when you have that, we also activate. Now what I mean by activation is we're actually activating neurological pathways to carry out certain actions, and by activating those neurological pathways we can start healing deficits that we find when we do our neurological evaluation. So for example, let's say that we find that you have, you close your eyes and you have the inability to touch the tip of your nose. Okay, that tells us that we have a cerebellar issue, we have a parietal lobe issue, and some frontal lobe issue going on. So what we'll do with that is there are specific therapies that we can do to activate the cerebellum, to activate the opposite parietal lobe, and if it's a planning aspect of things and we need to activate the frontal lobe, there's things that we can do for that. So we'll have you do your oxygen techniques so that you can get that increased oxygen flow, and then we'll have you doing very specific exercises to make those neurons fire, to make that neurological pathway fire. And when it does that, temporarily, you'll have those pathways start to work and you can actually finish the test and complete it properly. If you do this repetitively and over again, you'll actually rebuild that neurological pathway. And what will happen is when you do that, then the function starts to recover, and through neuroplasticity, you can actually recover these functions. So that's what we do with the neurological aspect, is we use fuel and activation in the theory of neuroplasticity to actually recover functions that have been lost due to inactivity, decreased neurological firing, or poor metabolic fuel supply, causing the brain to not work properly. So that's the other aspect between the metabolic and the neurological as far as the treatment that we offer in our Rewired programs. Hope this makes sense. If you have any questions, please feel free to post below. If you'd like more in-depth information, you're welcome to go back and watch the previous videos that we've done, or you can request our free DVD. It goes into a lot more detail and it talks about a lot of the things that we do in the office, and it actually gives you steps of what you can do to start recovering health. I look forward to hearing back from you. Have a great day.